The best of money matters. Right Business.
Welcome to The Right Business, where we dive deep into the stories of trailblazers who dare to disrupt the status quo, find the gap in the market to find the right business. Hello, I'm Hongbin Jeong. Doctors today face increasing pressure, not just from patient care, but from the growing administrative demands of modern medicine. Every consultation comes with notes to dictate, reports to prepare, and referral letters to write, tasks that often take hours after clinic hours, pulling specialists away from both their patients and their personal lives. And while technology has transformed many industries, healthcare has lagged in this area. Medow Health AI is here to address that gap. Built specifically for specialists, it automates the documentation process in real time, capturing and structuring clinical notes, reports, and referral letters while doctors focus on patient care. And to share how Medow Health is helping doctors reclaim their time and focus on patient care, joining us today is Clement Tan, Singapore country lead at Medow Health AI. Hi, Clement. Welcome to the show.
Hi, Hongbin. Thank you.
Thank you so much for joining us. Well, Medow Health AI has launched in Singapore market's first step outside Australia, but why Singapore? I mean, what made Singapore the right market to expand into? What gaps in clinical workflow does Singapore have that Medow Health AI is here to address?
Well, first of all, Singapore has a high concentration of clinics, doctors, and specialists. So we thought that this kind of technology would be embraced by the healthcare community here. One of the things that I think for Singapore as well is a lot of us are very aware of AI, the potential for it to potentially disrupt the way we do things. A lot of us are really embracing of this technology. So that's one of the many reasons in which we saw potential in Singapore as one of the areas in which Medow could expand beyond Australia.
Well, Medow has, grown to support over 50 medical specialties, capturing notes, reports, and referral letters in real time. When you talk about specialists here, who exactly are we referring to, and how does your AI adapt to the unique needs of different disciplines?
So when we talk about specialists in the healthcare context, this really refers to not only just the ones that are recognized by MOH, so that could be an orthopedic surgeon or a cardiologist, surgical oncologist, or a pediatrician. One of the things that sets Medow apart compared to maybe other AI scribes out there in the market is that we've built models for each of these specialists and each of these specialties. Just like when I go to a cardiologist and I say that my heart is racing, it has a very different meaning as compared to when I go to a psychiatrist and I say that my heart is racing. So making sure that the AI is built in ways that are contextually sensitive, as well as understand the nuances of the conversation that a doctor has with their patient, is very key to making sure that the quality of the notes and the letters are up to par.
So how did you decide which features to prioritize for, those in Singapore, and what was it that really clicked with the doctor users?
Early days here in Singapore, we learned a lot from the doctors and early customers that listened to our demo and tried our product, and a lot of them started using it in their clinics day to day. One of the first things we realized that here in Singapore, doctors are very particular about the information that's presented in their notes. The AI needs to be of really robust quality. They're very attentive to if the AI hallucinates, gets anything wrong, doesn't understand the nuance of their conversation. I think what we saw here in Singapore, especially at the specialist level, they handle very complex cases. So sometimes a consultation could be multi-issue, it could be multi-patient. So making sure that our AI is able to consistently create high-quality notes that understands the nature of the consultation, what the patient is there for, the kind of conversations where the doctor might be educating them, the implications of a diagnosis, finally even capturing the risks of different surgical methods or different surgical approaches that might be coming up in conversation. Quality is key. The second thing I think we also learned over time is that here in this market, unlike in Australia, people speak a variety of different tongues, they have different accents, different dialects. Sort of fine-tuning our product so that we could support multi-language context was also very important to us. And I would say that in the past couple of months, we've made great strides in that regard.
Well, speaking of which, you mentioned there you guys are offering multilingual support. But what made you decide to go beyond a standard AI scribe and offer these additional layers of support?
Well, one of the things that we're known for in Australia, in our home market, is the ability to go above and beyond for customer service. We do more than just make sure that, we troubleshoot issues. We spend a lot of time in person with doctors to gather feedback. It's still early days of AI, and so I think the player that wins in this market is one that really is attentive to local needs, nailing multi-language, having quality and nuance from our specialty-specific AI, and making sure that the doctors who are part of this journey know that their feedback and input is being taken into consideration. It can only help us make our product more robust, more agile, and develop it to meet the doctor's needs.
So is it able to pick up the language, for instance, in the Singaporean context? Is it able to pick up Singlish or even Chinese for those who are Chinese speakers?
So, when I go to the doctor as well, sometimes I might use Singlish. We found that Singlish works really well with our scribe. There's been no issues. And it supports languages like Mandarin, Bahasa Melayu, Bahasa Indonesia, Cantonese. I think recently we also put in Tamil and Hindi as well. So we're very proud of the ability to offer all these languages because healthcare should be inclusive and accessible for everyone, regardless of whichever language they prefer. I think oftentimes if I go into the consultation room and I see the doctor speak the language that I speak, I feel a lot more confident. So really facilitating that kind of patient care is really important for us. We want to make sure that none of that nuance is lost. But at the end of the day, the notes and the letters are still generated in the official administrative language that is English.
Right. Well, beyond just the language here, I mean, in the medical industry, we use a lot of clinical terms that sometimes AI might not understand when it just is a simple AI or a generative AI tool. So how do you train your AI models to understand these complex clinical language and specialty-specific phrasings?
Yeah, absolutely. And so that's key, right? I think more and more people are using AI scribes in the workplace to notate action items from a meeting, for example. And generic scribes can do a pretty good job, but oftentimes, it might get something really wrong. It might misunderstand an action item or it might not minute something very correctly. The bar for quality in a medical context is even higher because you don't want it to just avoid misspellings or failing to capitalize medication names. It needs to get it right to begin with. And the way we've been able to do so is twofold, right? The first is the AI itself architecturally is built to the medical context in mind. So it understands procedure names, medication names, it understands examinations that are being done, it understands when investigation results are being read out, so your test results and your scan results. And these are things that you can sort of build in conjunction with the AI model to make sure that the accuracy is as what you would expect for health tech and what specialists would use. And the second, obviously, is that, medicine is not static. It's constantly evolving and keeps pace with technological advancements too. And it was very important for us as we were building this product to have doctors and specialists themselves, not only just from customers providing feedback, but we also are proud to say that we've got a clinical advisory council. So we have got leading specialists across different markets who have been instrumental in guiding and shaping our business from the beginning. They are leading surgeons and physicians, and some of them are CEOs of hospitals themselves. And they've been very much helping the team to make sure that it's meeting clinical standards.
So what kind of feedback have you received from doctors using Medow, daily? How much time does it actually save for these doctors?
Yeah, so the main reason why someone would want to use AI Scribe in Singapore to begin with is it's really twofold, right? The first is they might be intrigued by technology and they want to give it a try. They are believers that AI technology is coming whether we like it or not, and so they would rather be early adopters than being left behind. But the second, obviously, is the kind that recognizes the potential for practically and pragmatically saving precious time, right? I don't really believe that anyone wants to go through years and years of medical school and become a specialist for them to spend hours a day dealing with paperwork. I think they'd rather spend more time with patients. Or even if they finish clinic, right, they want to spend time with their families. So the feedback we've heard from doctors who are using it is very promising. I think a lot of doctors here haven't yet seen an AI scribe in action. So my favorite thing to do when I go into their clinic and I give them a demo of the product is to actually see their faces light up, to actually see that, this is not a technology that is abstract, that it's ready for use. They can use it in clinics with their patients today. And a lot of them have recognized that it's not only just saving them time, but their entire clinic's administrative staff time as well, right? We have a lot of clinic assistants and clinic managers. They're the ones who are saddled with, writing the reply letter or writing an insurance memo or writing a summary of a case if they need to send it off to an insurer. Helping save the clinic minutes to hours a day, these add up over time. And time is money in Singapore. People would rather spend that time either going home and taking a break so that they can avoid physician burnout, or they can use that extra time and see more patients.
Definitely. I mean, time is money here in Singapore. But based on the feedback you're hearing now, do you see Meadow, eventually addressing pain points beyond documentation based on what doctors are asking for?
Yeah, absolutely. I mean, the reason why Medow was set up to begin with was because we really want to give time back to doctors. So beyond just paperwork and documentation, anywhere in the back office, anywhere in terms of administratively running a clinic where AI could streamline and make lives easier for the doctors and their staff, I think that's where we are very much focused on.
All right. Well, looking ahead, what new features or specialties are you planning to tackle next?
Diving deeper into ability to customize notes and letters, down to even personalizing at a per doctor level, the tone, their style, their way of writing the notes and letters. We are able to do that today already, but over the next couple of months, we're releasing new features that will give doctors control so that they can do that themselves if they so choose. We also want to make even more improvements to our multi-language capabilities. So, especially in a Singaporean context, we actually switch languages mid-sentence. Technology is incrementally improving day by day. So the ability to understand with greater fidelity and with greater quality is within reach. And that's what we hope to be able to do as we continue to improve on our product.
Amazing. Looking forward to it. Well, thank you so much, Clement, for joining me today.
No, thank you very much for having me. And hopefully the next time you see a specialist, which hopefully might not be so soon, maybe you'll see Medow in action.
Yeah, hopefully. Well, thank you so much, Clement, for joining me today. That was Clement Tan, Singapore Country Lead at Medow Health AI. This has been The Right Business with me, Hongbin Jeong.
Money FM 89.